This is a specimen of uterus in which the uterus appears to be torn. The right-sided adnexa is partially visible, left adnexa is not visible, cervical portion of the uterus is not visible, serosa is also torn. The tear extends higher up on the left side. It is most probably a specimen of complete rupture of uterus. Obstetric hysterectomy must have been performed on this patient. All the three walls of the uterus, endometrium, myometrium and serosa are torn. It is complete, and if partial, only two walls, then it is incomplete rupture. So, previous cesarean section scar is the most common reason. Upper segment cesarean, classical, is more dangerous. Lower segment also if the interval is less than 2 years. Then any surgery done on the fundus of the uterus, which goes through and through the three walls. Even DNC procedures and like obstructed labor cases are all at high risk. So during the active labor, there will be severe pain in the abdomen, especially at the site of the uterine scar. There will be vaginal bleeding, contour of the uterus will be lost, कॉन्ट्रैक्शंस शुरू में तो रहेंगे, धीरे धीरे कम होने लगेंगे, फीटल पार्ट सुपरफिशियल फील होने लगेंगे, पीवी पे प्रेजेंटिंग पार्ट ऊपर रिसीड कर जाएगा, है ना, और पेरिटोनियम में ब्लड के कारण डायफ्राग्मेटिक इरिटेशन होगा और शोल्डर टिप पेन भी होने लगेगा. ओके, so if the uterus is repairable, you repair it after urgent laparotomy. Otherwise you have to remove it, perform an obstetric hysterectomy. Usually rupture occurs during active labor, but sometimes in the late pregnancy, cases of previous cesarean section, they go into rupture, and with unusual symptomatology they present, like headache, epigastric pain. So there should be a high index of suspicion for those cases. So obstetric hysterectomy is subtotal hysterectomy, where clamps are applied up to the uterine artery only, and Mackenrod's ligament is not cut and light. So abdominal pain, hypotension, tachycardia, bleeding per vaginum, hematuria, and loss of contractions, all these predict. So one previous cesarean section with low transverse incision, history of previous vaginal birth, scar thickness more than 6 mm, and indication other than failure to progress in the previous cesarean, good sized pelvis, and a longer duration from the last cesarean, at least more than 3 years. Flamm Geiger model to predict the chances of VBAC success, and a score of more than 8 has good chances of success. So it takes into account cervical factors also, like effacement and dilatation.